presentation. I'll be discussing mental health and substance abuse among, of course, young people in Nigeria. My objectives include understanding the prevalence and patterns of substance use among youth, identifying the link between mental health and substance abuse, recognizing common substances and their street names, understanding diagnostic and assessment challenges, learn evidence-based treatment and prevention strategies, and lastly, apply practical youth-centered interventions. By way of introduction, mental health and substance abuse are two of the most pressing public health issues of our time. I would say that they are two sides of the same coin. Across communities, young people are increasingly exposed to substances while simultaneously navigating emotional, social, and economic stressor, which is young people in our communities today are not exempted from the various stressor that bedevils every human being, including adults. But of course, maybe at different intensity and severity. So, which is why young people, unfortunately, may not be equipped with the right skills to handle these stressors, and then may unknowingly or knowingly get involved into seeking strategies to cope, and then get around the use of unhealthy coping strategies, which, of course, drug abuse is one of those unhealthy coping strategies. Understanding how mental health and substance abuse intersect is essential for early identification, effective intervention, and even long term recovery. If an individual's mental health is not properly assessed in treatment or in assessment while engaging with the therapist, chances are very high for relapse because mental disorders, psychological issues, emotional problems may be the reasons why the individual took to substances in the first place. If these things are not properly addressed in treatment, then these individuals may return to their previous behaviors. Uh, by mere way of definition, the youth is defined as transitional period between childhood and, of course, adulthood independence, generally characterized by vitality, growth, and development. One thing I would say that is not mentioned on my slide is that this phase is also characterized by seeking of sensations, impressionability, and of course, the need to experiment for curiosity. The United Nations defines the youth for statistical purposes as individuals between 15 to 35 years. Now, what is substance abuse? For the purpose of this discussion, we would restrict ourselves to substance use as the consumption of psychoactive substances, such as alcohol, illicit drugs, or misused prescription medications that alters mood, perception, and consciousness. Now, you would see that alcohol is mentioned here. Most people ask me, is alcohol a drug? Before I go on, I'll quickly say that the word substance and drug will be used interchangeably in this conversation. Yeah, so most people argue that alcohol is not a drug, but the definition of a drug is simply any substance upon which its injection into the body changes the physiology or how your body functions. So any substance that gets into your body and changes the functions of your body, then it qualifies to be called a drug. We have seen several individuals admitted in the facility for treatment of alcohol use disorder. Now, and we counsel that individuals who have suffered any form of drug addiction aside alcohol use disorder should even abstain from alcohol because these are gateways of substance use. For instance, other gateways include cigarettes and then other substances that we may refer to minor substances. However, there is nothing like minor substance. Most people also use terms like hard substance. hard drugs. That again is being discouraged because when you tell a user that he uses hard drug, the psychology there is that there are substances that can qualify as soft drugs. Now, what that can mean is that they can indulge in those soft drugs while staying away from the hard drugs. But like I said earlier, any drug that has the capacity to influence or affect how your body functions upon use is a drug. So that being said, any of these use, whether licit, in which case alcohol is licit, cigarette is licit in Nigeria, other prescription medications are also licit, which we are going to look at today, e.g., codeine, tramadol, and other substances that are being injected by way of parenteral injections. Now, all of these are even prescription drugs. Now, their use outside of prescription can qualify as a misuse of substance or drug. The use is what I have defined earlier as the consumption. So, drug use or substance use is simply the consumption of these psychoactive substances. While substance or drug misuse, is the use of these substances outside the purpose or without prescription or recommendation by an expert. That is where self-medication comes in. If an individual is asked to use a particular substance 3 times a day at a dose of 10 milligram, and he or she chooses to use 20 milligram 6 times a day, the person is not using as prescribed. Now, what addiction is not substance abuse, it's not substance use. Addiction is defined as a chronic relapsing brain disease characterized by severe drug-seeking behavior, which we call craving. Characterized also by the chronicity is established, which is the first C of addiction. And then the severe craving mentioned, and uncontrollable use. The person uses substances outside of his or her control capacity. There is also an established compulsiveness in the use of substances. It is as if you are under an influence, a force. An individual is under an influence, a force, compulsing the person to use that substance. And the last C is the fact that in the face of negative consequences, this person experiences all of this. The person uses, he craves compulsively and uncontrollably in the face of negative consequences. So it is it is needful to say here that those who suffer drug addiction are actually aware sometimes or even most times of their consequences. They tell you how much this has drained their finances, ruined relationships, affected academics, and many other areas of their lives that have become dysfunctional by way of using the substance. But however, they lack the capacity to stop the use of the substance. All right, so we'll move on to understanding common substances used by youth. I have mentioned quite a number of them: alcohol, cannabis, crack codeine, and the rest of them. Over 35 million people worldwide have substance use disorder. And then 14.3 million Nigerians. This research was done in 2018 by the UNODC, NDLA, Ministry of Health, and other MDAs who contributed to this research. Now, that again tells you that we are almost 10 years away from this research date. So the need to perhaps invest in more research that is also current. Youth account for a significant proportion of these statistics. Cannabis, cigarettes, tramadol, codeine are among the most misused substances. Onset of use is increasingly earlier than age 15. Now, the research I just mentioned, although not on the slide, actually were for those between the age of 15 years to 64 years. Now, what happened to those who use substances before the age of 15 years? They are not captured in the statistics. I personally, speaking to you, I had indulged at the age of 11 years. So that means that if I was using at the time of this research, I won't be captured. Our works in the last about a decade ago in this space, in secondary schools where we carried out some researches, had shown overwhelming evidences of substance use among those lesser than the age of 15 years. There are common triggers of substance use. One is unemployment. Mind you, I said common triggers. I didn't say causes. Most times you hear people say, what are the causes of drug abuse? There are no causes of drug abuse because if you say unemployment is a cause of drug abuse, it should mean, therefore, that everybody who is unemployed should be using drugs. It should also mean that those who are employed should not use drugs. But I tell you that there are many individuals who use substances because of their own career, because of their own businesses, because of the stress of their work, of their occupation. So these are therefore triggers. It means that they can be more manageable than we thought, as against what are the causes. The second could be peer pressure. Same explanation goes for peer pressure. You have young people who have stayed in the same room for a month to 1 year or more with people who uses substance. Some of them never used, despite this high level of contact, while others with lesser contact time begin to use. Relationship stress, academic pressure, curiosity, family conflicts, loneliness and social isolation, untreated mental health symptoms, which of course establishes the link for this discussion today, drug abuse and mental health. People have issues resolving grief, loss, or abuse in whatever form. Unfortunately, we see an ugly trend today, which make lead to the effort that individuals like the Nigerian American Institute of Mental Health and many other organizations are putting out there, especially with the normalization going on social media and other social networks that seems to make drug abuse the new normal, as if to say that you can't be successful, you can't be a good artist without using substances. Everybody is doing it. Now, these are some of the triggers. Now, why have I played less to cause of drug abuse with the regard of triggers mentioned? It is because when individuals are able to achieve certain eco-social skills, it can help them manage all of these triggers, therefore preventing substance use. Why are youth more vulnerable? Brain development continues into the mid-20s. High sensitivity to peer influence at this time. This is because the prefrontal, there are two parts of the brain that I would want to mention now. There is a part of the brain that controls reward, that controls short term, that controls pleasure. That part of the brain is located around the brainstem area, amygdala, and some other complexes in the brain area. Another part on one end is the prefrontal cortex. The prefrontal cortex is the part of the brain that controls long-term decisions, the part of the brain that controls intelligence, decision making, learning, and many other areas that informs how an individual views the world. However, in the young person, between just about the adolescent age, and of course, between the mid-20s, we notice that the area that controls reward seems to take the lead in maturity than the area that controls long-term decision, worldview, and all of that. So what that produces an individual who is highly sensitive to pleasure, highly sensitive to reward, to feeling good, to sensations, and what have you. And so it goes on to affect how they see the need for acceptance by peers, and of course, the desire to feel belong to a group. Unfortunately, again, they are vulnerable because of the limited coping skills, which I mentioned earlier, as you might have with some adults. Exposure through music, social media, and environment are some of the factors that makes youth more vulnerable to substance use and mental health disorders. Now, what is the link? Mental health and substance use. They coexist often because there are individuals who the only reason they started using substance, like I said, is about the desire to cope with stresses, which could be life stresses, it could be stress with family, it could be stress with peers, it could be stress with economy, any form of stress. And then they have a difficulty with coping. And they begin to manifest symptoms they may not be able to understand. E.g., they can become very anxious. They can become depressed. They have low moods. They can feel, some people suffer abuse and become traumatized from the abuse, whether verbal, physical, or any form of abuse. There are young people too who suffer childhood disorders like attention deficit hyperkinetic disorders and many other behavioral disorders in children and in youths. And of course, unfortunately, the inability or the limited skills available to younger people. Now, when faced with this incapacity to handle all of these stresses that keep bombarding their young minds, they are susceptible, therefore, to seek strategies to cope. And so, if they lack these strategies to cope, healthy coping strategies, friends might begin to inform them. You could try coding, you could try this, you'll be able to sleep well. An individual who is very anxious may not be able to have enough hours of sleep. And upon reporting to a friend, I have difficulty sleeping, the friend might just say, use these substances or use this substance, you'll be fine. An individual who have low moods all the time in class and then tells his friend or a friend asks out of concern, you look down, what's the problem? And the friend says, oh, I didn't pass well, my mom had insulted me, or I am being bullied by classmates who I do not have the power to overcome or to, resist. You might just be advised to come on, light up your mood, just take this and smoke it and everything will be fine. Or an individual who lacks communication skill, does not have the ability to speak about his emotions or her emotions, feelings. So maybe a peer could be opposite sex or same sex. And then suddenly, if colleague is advising, if you use this substance, you'll be confident to express yourself. Now, all of these things are some of the psychological disorders that can lead. For instance, something that is beginning to emerge now is the body image, where young people begin to compare their bodies to other individuals in their class or in the society and become dissatisfied with how they look. It is because it gets so bad that young people may be advised to smoke and take alcohol just so that they can lose more weight or have flat tummy. Now, some can get hooked while indulging in all of these advices from young people. So if you look at it, you would realize that young people today are faced with several mental health stressors that they do not have the skills to handle. And then they turn to unhealthy skills, unhealthy strategies to deal with those stressors. However, a group that I am always passionate about are those who even have physical illnesses, people who suffer sickle cell diseases, people who suffer fractures, trauma, physical traumas, who, because of severe pain, I've had a woman who had cesarean section, and after that incident, she had some injections given to her to manage her pain, because pain management is key in medical management. Now, unfortunately for her, she got hooked on one of these injections that were given to her. Do you blame the person for morality? Why the person could not keep high morals to resist drug? Of course not. Now, there are many of these people again that are hooked on these substances that society today discriminates and even criminalizes. Fear of punishment or stigma, taking it from what I said last, are some of the diagnostic challenges in youth, in many youths, because they feel that people are going to stigmatize them or even punish them. Parents who do not create safe space at home where young people can engage them may not be able to discuss to their parents. I mean, children may not be able to discuss to their parents on the things friends are telling them or the problems they are facing. I remember at one of the conferences I mentioned that mental health should be considered as a key area, especially for young people, adolescents. And the mother said, what do they know about mental health? Every time they say my mental health is threatened, of course, they do have mental health issues. And like I said earlier, unlike adults that would have gathered experience in life that may help them, younger people are not so. They are vulnerable, they are impressionable, and they have limited skills to even handle life stresses. The second reason, second challenge, diagnostic challenges in youth is denial by youth or even caregivers. Many parents, even when you extend effort, care efforts to them, they say, no, 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 my child doesn't use drugs. Why? They feel that it's going to bring shame to their family if they bear it up that their child suffers drug addiction. Symptoms overlap with mental illness. Most people ask me sometimes, oh, my child doesn't have any problem. It's just drug that he uses. It has not affected his mind yet. And I said that the reason that you are even knowing right now about your child's drug use behavior is simply because it has already or is affecting the mind of the person. No child starts using drug with the aim of making it known to his parent or to her parents. The first reflex would be to hide the behavior, not use at home, use covertly, clean up the mouth, not to use few hours before returning home so that nobody perceives the smell or nobody sees the red eye. But the time comes when the young man is not able to manage the urge and cravings. And so he's going to learn to bring it home and then find a way again to hide it, probably use in the room, use at midnight when daddy may be sleeping or mom may be sleeping, or go to the park, the garage, just find something to do or use the toilet. But a time again comes when this person would not even be able to manage these behaviors to continually keep it away from family. And then families begin to realize that, oh, there are changes in peers, there are changes in sleep pattern because apparently he stays up the night, checking on everybody, tiptoeing around the house to be sure mommy and daddy is sleeping, brother is sleeping, sister is sleeping, lock himself in the room, even though he's not expecting anybody to open his door. That is where they began to express paranoid behaviors. And then use the substance and probably again scared to sleep. And eventually the day breaks and he starts sleeping when others are awake. Or you have to wake him up, someone who normally would wake up before every other person gets up. Again, some of his friends or all his friends will not agree to his behaviors or his new behavior. And so some will leave. And then he would replace those peers with those who are using or indulge in same behaviors as him. So all of these things are already telling you that this young man is beginning to use the substance without control, compulsively, craving for it, and is becoming chronic. It's not a week, it's not a month, it's getting into months. And so by the time a parent is getting to know about their child's drug use behavior, it's already worse enough. It's already bad enough. At that point, an intervention should be considered, not to play, handle with gloves hand and just relax about it. They should seek an expert advice. What worked best for youth? Early intervention, strong therapeutic alliance, youth-friendly language and spaces. Unfortunately, most of the messaging by many advocates today in secondary schools may be those employed through scare tactics, fear-based. You tell a young girl, a young boy, oh, you see this auntie in this video, he used drug or she used drug, and you know what happened to him? She got mad. But this same person, this same child understands how that an uncle of his uses substances, but then he's not mad. and probably showing responsible behaviors than another uncle or even parent that uses, that doesn't use. So the young person is going to feel that you do not have full knowledge of what you are saying, or you are lying to him or her. And so when they feel that you are lying, they don't trust anything you are going to say. Now, so we must look at the messaging techniques, right? Young people must know that, you see, we have different biological makeup. There are people who will use substance and it will not affect them. They may never get to the point where they would require intervention to stop. And that group form the largest, 85 to 90% of individuals. While some other group, just about 10 to 15%, are actually affected by the use behavior that will require intervention before they can get off the use of the substance. That being said, nobody knows what group he or she is going to fall into, which is why you are not going to use your life for an experiment. Skill building, emotional regulation strategies, and healthy coping strategies are one of the things that work best for young people. Purpose, structure, and mentorship. Young people must be taken through self-identification exercises, purpose for living. These are some of the ways they can be assisted, to build resilience, problem-solving skills, communication skills. There are several other psychosocial skills that will help a young individual build resilience towards against drug abuse, and of course, other maladaptive behavior. Because like I always say, drug abuse is just one behavior among many other maladaptive behaviors that young people indulge. That being said, there are many approaches to evidence-based treatment, which include family therapy, trauma-informed therapy, community and peer-based programs, cognitive behavioral therapy. The approach should be non-judgmental. If a young man comes and says, or a young lady comes and says, "Oh, sir, I use so gram of these substances or this substance," the first thing to say is not, "Oh, you are a bad child." The child may not come back to you again. Now, mental health screening is very important. Substance use history, clerking are done, at the time of first contact and all. Family and social context awareness and sensitization. On prevention and mental and early intervention, it is important that we begin to incorporate mental health education in our schools, life skills and coping programs, as mentioned earlier, honest drug education, not fear-based, safe recreational spaces. And this should not just be in schools, even at home. There should be time set aside where children can have non-judgmental, conversations with parents. I remember growing up where a parent would call the children and sit them down in the morning and say, "Oh, tell us, what are we doing that is a problem to you? Tell us." And then anything you say in that meeting will be used against you in the court of family justice. Now, those behaviors have to change if we must create that safe space where our children, young people, can communicate. Now, this is because as a young man grows or a young child grows, he's going to be seeking the sense of belongingness, which is about the fourth level in the Abraham Maslow's 5 hierarchy of man's need. A young man, a young girl gets to that level where she wants to feel belong to a group, which is what affects, of course, the body image I mentioned. You want to be among the ladies that are ascribed as being curvy, as being figure eight, as being this, as being that. Now, what that tells you is that it is a desire to belong to a group. Now, if a family is strong enough a group for a child, then the desire to belong to a group outside the family that can cost the person's mental health and make him or her begin to indulge in abnormal behaviors, the chances will be lesser. Why? Because the group at home, the child sees his or herself as a member whose opinion is valuable, whose opinion is sorted, whose opinions are respected. Now, these are some of the things that informs how bonded an individual is to a group. That being said, we would move on to discuss recovery and long-term well-being. Recovery is a process. It's never an event. It is different for every youth. I always say that recovery is a lifetime journey, and uh, it does not follow the same course for everybody. An individual can get into rehab, spend 3 months, which is about the minimum advice for any individual who requires a rehab care program. Upon discharge, the person relapses despite all efforts being done. The person gets back to treatment and may have several relapses. But then it doesn't mean that rehab care program is has failed or is a failure. No, because recovery, success in treatment is not just about abstinence, it's about improved functionality, both in the person's social life, relationship, academics, health, and what have you. Recovery has to be supported by family, community, and systems. Focus should also be on reintegration, which would include discussions around the person's environment and other factors that could affect externally the use behavior. Of course, it should be focused on purpose and hope. In conclusion, youth substance use is a serious public health concern that requires urgent attention. I do not still understand why we tag many illnesses. Of course, in their own right, they are epidemics, they are pandemics, and they are given at least moderate attention that they deserve. Unfortunately, drug addiction is not so, even though it is even a worse pandemic than some of the illnesses that a lot of monetary budget resources are focused at. With strong mental health support, early intervention, and compassionate education, prevention and recovery are possible. Every young person deserves dignity, care, and a chance to thrive. Thank you very much for listening, and I'll be here for your questions.
Wow, thank you so much, sir. That was a very enlightening, amazing, insightful, powerful presentation. If we could all give a clap, emoji, encouraging and being thankful to our presenter for the very presentation. Please go ahead, go ahead. You can type in the comments. Thank you, sir. We are grateful, Dr. Hope. We are so grateful for your help. So we are grateful for the exposition. We are grateful for the enlightenment. I used to think that I was such a huge mental health advocate. I actually am. In fact, I remember in 2023 when my journey began, it began with a personal story. I met a friend in NYSC whom I believed was an amazing person, except for his addiction to weed. And that threw me into a world of trying to help him. I learned a lot of things in that journey. Number one is that you really can't help a person that does not want to be helped. That is the unfortunate thing. If they do not recognize their situation as a problem or their condition as a disease, you can't do much about it. You can talk, you can point them in the right direction, you can be there to support, you can pray. For those of us that are spiritual, doesn't necessarily mean much will come out of it. I remember coming across a program on YouTube called Soft White Underbelly, where a lot was discussed. This particular person interviews what I would call, or what we would call, the dreads of the society. And one of the few things you would see, one of the prevalent things actually, is that many of them were drug addicts on the streets in America. Their families have excised themselves from them. They've been excised from society. Um, they just lead very meaningless lives, only to get high and die afterwards. And I remember I drew up my what would I call it now? My top 15 rules to life. That's when bothered across making sure that I take care of my children, because I saw that one of the prevalent things was the fact that the families were not present for the children. The parents were absent in 80% of the addicts' lives. The system failed them, the family unit failed them, the society failed them. And this brings me to my first question, Dr. Hope. I hope you're still with me, Dr. Hope.
Very well. Yeah.
Okay. So I would my first question would be, should our music and movie stars do more to stop making drugs look cool? I'm asking this because I was listening to a famous US rap artist. We know him by the name Offset, and he was singing Percocets, Molly Percocets. And kids are jamming to rap and trap, and then they're listening to these. And then these are the simple ways, these ideas to use drug because it looks cool, sip into their subconscious, and then they are inquisitive and they want to try it out. What do you think about it? Should music and movie stars do more to stop making drugs look cool?
Of course, yes. Cultural influencers shape norms. We discussed earlier one of the triggers for drug abuse in my presentation, where I mentioned normalization, where drug abuse has become to look like the new normal. When substance use is glamorized without consequences, it lowers risk perception among youth. The person feels that the risk, you know, in indulging these behaviors is lesser. That is why people are always doing it. So, responsible storytelling
Mhm.
and balanced portrayals can significantly shift public attitudes. And so, if these organizations, there are bodies that regulate artists, musics, videos, and all of that, I think they should do more in ensuring a safer uh, project embarked upon by artists, which will be viewed by our younger generation.
Thank you very much, sir. I hope we are taking note of it. And for parents, especially parents and would-be parents, what are the tiny warning signs that we might miss at home, tilting towards a child beginning to use or become addicted to substance?
Yes, so I will just again recap on some of the early warning signs I mentioned, where an individual may stop engaging eye contact with parents. For instance, there are many signs you can pick from the face of a young person who uses substance or who has just used. One of the reasons I never indulged in alcohol use when I was taking substance with my friend was because I was scared that my father will have high perception of smell to alcohol because yes, he was a user of alcohol at the time. So you see, that didn't let me use alcohol, even when my other friends were using with other substances. Now, in the face of this child, you can see whether or not he's maintaining eye contact. A child who is trying to be dodgy in looking at your face, apparently, most likely, is trying to hide something from you. Because why? In the eye, if you are careful enough, you can see a dilated pupil or even an abnormally constricted pupil, depending on how very sharp one's eyes are. You can actually see through and say, "Ah, why is your eyes looking like this?" You could also see a red eye. Now, you could also notice maybe something whitish left in the nose of the child that he may have forgotten to clean up properly. All of these things you can pick by looking at the child's face. Another thing you can also do from the child's face is the affect of the child. Is she unusually looking very bright? The affect, the person's mood on the face is so bright, is so looking so happy, or the mood is looking so down on the face. Or again, apart from what you can see, what can you perceive in sense of smell? I mentioned alcohol smell, smoke smell, and all of that. Your child used perfume maybe while going out. He's coming out, you can still perceive the same intensity of perfume on returning home.
chances are that he may have or she may have used and then try to spray perfume to reduce the smell of the substance that was abused. I'm not saying that every child that smells fresh all the time is using substance. But yes, if that is not the pattern of the child before, suddenly that has changed. You should begin to see, could it be that a girl or a boy is telling the boy or is telling the girl, you need to smell nicer? And then that is why the person is becoming more careful with personal grooming. It may not be that he's increasing personal grooming or hygiene. It may just be that he's beginning to change that pattern because of substance use that he's trying to hide, from families. Another thing is the change in sleep pattern, which I mentioned earlier. Another one is even the eating pattern. Does the child eat more now, or does the child eat less now? Sudden loss of weight, that is another one you need to look at. Change in peer pressure. He suddenly stopped seeing Malik or Kevin. He is now seeing Bright or Abdul. You need to look. Where is Malik? Where is Kevin? Or where is Joy? Where is Bridget? What has happened to Fatih? Why am I no longer seeing you with Fatih? Now, you also need to check school truants to school. Sometimes it's important that if we are so busy, just pick a day and be sure, pay surprise visit to your kids. Are they in school? Engage with the teachers. What are my child's behavior? Who are my child's friends? Create a safe space where your child comes home and you can ask your child, who are your friends? What do they do? What do you like about them? What behaviors do they do that you like about them, that you intend to copy? What behavior do you not like about them? So it's important to know your child's friends. Now, because this will help you to know when they begin to change. Now, another one is the fact that they may begin to miss out on house chores. Is meant to wake up early in the morning and clean daddy's car or something, but the child wakes up very late and is not able to do it. He said, I'll come back and do it. He never came back to do it. The child does not keep to curfew time. He's meant to be home by 4 p.m., but he's coming by 5 p.m. and giving reasons that are not substantial. These are some of the many other reasons that, signs, early signs that families should be in the watch out for. Again, there are some substances that are used which are non-conventional. A child does not even need to leave the house to use these substances, e.g., petrol. We've seen an overwhelming evidence of young people sniffing petrol, sniffing glues. So you enter your child's house, a young girl or young boy who has nothing that requires a super glue or petrol, and suddenly there's a handkerchief in his room or in her room that smells petrol. It should alert you. Or you enter a child's house, you are seeing Mortina, you are seeing a Coke, and with some strange substance like maybe Maggi from the kitchen. You need to begin to query what is happening here. You see a young child who doesn't read newspaper because it's even boring to many adults. Talk more of a young child who was never or has never shown interest in reading newspaper. But because daddy say move them to Mama Akara, he moves them to Mama Akara, but keeps one that is very old. And then you realize that the pages keeps reducing. You need to question what is the child using the newspapers for. You see, these are some of the things that we keep evolving. People sniff spirits. You need to check, are there bottles in the house, in the child's room that are covered? What is inside the bottle? Could it be urine that is being fermented to sniff and all of that? Yeah, so I will stop here for other questions.
Oh, that was a lot to take in. There really isn't any limit to what can be abused now, is there? I believe parents should be very vigilant, hyper vigilant. The days of giving out the roles of parenting properly, being vigilant, being watchful, being available, being present, and being there is they've come to an end. You've got to do the hard work of being available and being present to watch over your children, help them sift their decisions, their choices, understand what they are doing, why they are doing it, and how best to get it done so that they do not fall into the sadness and to the the unfortunateness of being an addict? Now, this is a very interesting question. Does arresting the users instead of the sellers make the health crisis worse? And why do you think so, sir?
Of course, it will arresting users instead of those who are
Sellers.
selling would definitely worsen the trajectory of drug addiction and abuse in Nigeria.
Hello? Hello, Dr. Hope. Are you still with
In the
us?
last decade, I've seen influencing the perception of those who use substances. A couple of times I've been called by NDL officials on the road who had just accustomed during their search a young person who was seen with maybe 2 tabs of tramadol without a prescription. They just counsel and then advise them to see a therapist and even give our numbers out to them. Now, that again gladdens my heart because, this person is not being arrested, statement is taken, is allowed to go. And I've had a couple of parents who followed through and brought their child for counseling. So as against when any substance is seen with you, you are arrested. Because if you see a particular size of a substance with somebody, you can judge. A trafficker, a seller will not be going around with this quantity. But a user will not be going around with a particular quantity of a particular substance. So you see, yes, when we criminalize this, when we punish, when we arrest people who are users, who are actually sufferers, who are actually sick, that requires treatment, support. When we arrest them, we are further deepening the curve. And then, of course, you would breed more stigma, more people running to hideouts to use and not coming out for help.
Thank you so much, sir, for that. I remember watching the same documentary series I talked about initially, and how the prisons were really full of addicts, and that didn't change anything. More people on the street were getting hooked to substances. The sellers were out there being very vicious, just looking for money, not caring if people were dying, and more people were arrested to the point where even the officers stopped arresting users. Like they could literally see you smoking meth with a pipe on the street and walk past because the prisons were already full and nothing was really changing. Thank you so much, sir. I know you run a facility, and that's why I'm asking you this question. How can the regular family in Nigeria afford good rehab when the costs are so high?
Can anyone hear me? Could it be my network?
Oh, hello? Hello, sir. We
Yeah, I can
lost you
hear you
for a
now.
bit. We
Oh,
lost you
okay,
for a
sorry.
bit. We lost you for a bit. I asked,
Okay.
how can a regular family afford good rehab when the costs are so high?
Well, we need uh, a staged care models. It's not every individual that needs to be in the rehab. All right, some can benefit from community outpatient programs. Like you said, a regular family will find it difficult to afford the cost of rehabilitation, which is about a range of 500 to 600,000 naira, 1 million naira, and even more, depending on the center, the resources they are invested in the facility. But how do we get out of this? How do we get people, to receive the care that they need? One of the things we can do is to tier the care models. First is community outpatient program that I mentioned. Then insurance coverage expansion. Maybe those who have insurance packages can make demands or find a way to advocate that mental health should be included in their insurance cover. I do know that some insurance packages covers this, but yeah, there are some who don't. So it's important that we can push further for insurance coverage expansion. Another way is to, you know, have government subsidized slots. Now, the first one I mentioned, which is the uh, community outpatient program, is being practiced by my organization, Vanguard Against Drug Abuse, aside our institution-based treatments that we have two centers for. But in several communities in Kogi State, in Abuja, we've had community-based drug rehabilitation program where young people are enrolled every 3 months and are taken through this program for 3 months. The therapy sessions, stipends for logistics, free drug tests, free medications, and at the end of 3 months, those who are negative to drugs are finally taken to our sponsors and they are empowered economically. This further reduces the chances of relapse. Now, these are community-based programs that individuals should, who have the resources, can begin to invest into if they are concerned about the rising drug abuse in the communities. Now, the government subsidized lot again is one thing that my first lady, the first lady of Kogi State, the wife of Kogi State governor, is invested in. For instance, just a month ago, we had discharged some patients from our facilities, and we
Wow.
currently have almost 20. She's doing 42, two for each local government in Kogi State, two individuals, young people who have drug addiction to be brought into the facility for full treatment, after which they are economically empowered. You see, the government can decide to subsidize treatment fully or partially to
Okay.
expand the availability and the affordability for care. NGO partnerships, again, I have an organization, the Choose Life Foundation, who also is a mental health based organization, who currently have two patients in my facility that they are paying fully for. you know so NGOs can partner and get people treated. Then employer supported treatment, an employee can get support from his or her employer for treatment. That has also happened. Not every patient requires expensive inpatient care, which of course give credence to the first that I mentioned, community based drug rehabilitation program. Thank you.
Thank you very much, sir. Um, I would like to give you the opportunity to speak about your facility and your foundation, sir. If you don't mind talking to us about it, enlightening us about it, I believe this is going to be an opportunity for us to hear more about the good work that you are doing, sir.
Okay, thank you for the opportunity to talk about my facility. We are a specialist drug and mental health organization. We've been running for about 9 years now as an incorporated organization. But yes, we've had activities before our incorporation. We started all from the streets of Nyanya, Kabusa villages, villages in Benue State, Lagos, Kwara, and other parts of Kano and other parts of the country, with zealous volunteers who are passionate about the rising of drug abuse in Nigeria. We have also embarked on several policy formulation processes through advocacy and formulation and all. Of course, we have interfaced with several arms of the government to sensitize the ministries of health, the NDLA, NAFDAC, and co, and other MDAs. We currently run two specialist drug rehab centers with experts including consultant psychiatrists, medical doctors, clinical psychologists. You see, talking about the mental health expert drain. You see, for you to be a licensed clinical psychologist, the least qualification is an MSc. Now, you need to begin to ask yourself, how many of these do we have? In my facility, for example, yes, we have two with PhD and many others with MSc and interns also who are interning at the facility as part of the academic requirements in their various universities. Now, so you see, let me divert a bit. Government must invest in training experts. Is very important because what is a rehabilitation care facility without the experts who have experience and, of course, passion for what they do. Yeah, so yeah, we have these facilities with about 50 bed space capacity, and we are currently in communities, as I mentioned earlier, in Kogi State and in Abuja, doing community-based drug programs, at the level that I had explained, up till reintegration and economic empowerment. We are seeking to have a conference soon, to unveil how we can scale that community-based project to the national level to cover the 744 local governments of Nigeria. Right. So of course that will have to bring many other people, investors on board for this project. Yeah, so this is one of the many of the things we are doing. And of course, I'm here presenting today on your platform.
Please,
Yeah.
sir. We are
Mm.
very grateful, sir. I was going to ask the question of the brain drain problem and how we are going to treat people considering the burden of the disease in the country with the ever increasing influx of qualified doctors from away from the country. And you already just talked about it. We need to invest in training people that can take care of addicts, professionals, doctors, clinical psychologists,
I think I
consultants,
lost.
psychiatrists to be able to address the burden of addiction in the country. And this is going to be my last question. I'm going to ask this because it is important at every level for everybody. How do you,
Mm.
how do you, what do you think we can do to teach young people and growing people how to cope and emotionally regulate instead of abusing substances? Where can they go to get this training? Because I believe the family unit is failing. If not, we will not have lots of people confiding in their close friends instead of their parents or their siblings when they can't sleep well, when they are bothered by school stress or by life stress or by bullying or by picking. How do people learn to cope? What are the coping skills to be learned? Thank you, sir.
The expert done because again, this is not also cheap. If not, I would have just read out, oh, go to centers, go to our hospitals, the government hospitals have psychologists, they have these, just go and, request to see a psychologist. Now, but they may be on the waiting line for God knows when and how long, right? So, and of course, for the private entities, have to pay out of pocket, and even some of these people can't even afford to pay that, right? A task shifting, you know, so we need to train community health workers in addiction care, social workers, nurses in addiction care, people who are passionate about society, can be trained. You don't necessarily have to go through the rigorous training of a psychologist, a psychiatrist, to be someone who can provide care for an individual suffering addiction, or to provide counseling, coping strategies, therapies, and all of that. So we need to begin to find ways, either as organizations or as government, non-governmental organizations or government organizations, begin to look at how we can, expand the task shifting, right? So get your other people who are not necessarily psychologists, train them on mental health first aiding, on counseling, on active listening, and all of that. Some of these children just want somebody to listen to them. All right. So it's important that we begin to think in this direction. But however, if you ask me where can they go to, I would say hospitals. I would have said parents, but unfortunately, some parents do not even have these skills. So it means that parents should begin to invest in skills like this. I remember in 2019, I partnered with the Ministry of Women Affairs then to train about 250 women, on uh, women and family drug education program. And those one part, the topics discussed included uh, drug addiction, what it means, early signs, all of these things are topical issues to be discussed, prevention in each of them, and then of course appropriate response to drug addiction issues in the home, because the fact that a child uses drug does not end it. How do you respond? What should you do?
Not only the child who is expected to know the coping strategy, the parents should also know so that they can help aid those coping strategies. So what are expressed emotions? How can this affect your child? What level of emotion are you eliciting to your child? And all of that. So these discussions are very important. Okay, so parent, leaders, religious leaders. So another place turn to is religious leaders. A child misbehaved, the mother called the pastor or called the malam. And in most cases, it's either the child is warned or the child is punished. So you see, religious leaders should equip themselves with all of these skills too, so that they can assist children with these coping skills and strategies. So yeah, everyone should be educated to a very large extent. So one of the prevention mechanisms and strategy would include psychosocial learning. Okay, emotional literacy and awareness. All of these things should be for everybody. People should learn these things. So all people should learn them. So even at the younger age, if people are not born with those capacity to be self-confident, to be assertive, but they can also learn it. So you see, those who are not born with those traits can learn them. So if we begin to let our children learn all of these skills as much as we can, then it's going to help them to cope when they are faced with those stressors that can be peer pressure, that can be academic difficulty or whatever.
Thank you so much, sir. This was so enlightening. It's so important because it begins from the home. Every addict was once a child, an innocent
Mm,
baby brought into this
mm,
world, a tabula rasa. And
mm,
various influences or lack of influences, if I might say, led and built up that child into what it has become. An addict on the street using drugs to
mm,
cope with stress, to cope with anxiety, to cope with depression, to cope with pain. We all should be held accountable and play our part in ensuring that every young person is feels accepted, feels they can be listened to, feels like they have a community that they can trust and they can rely on and they can be themselves with and they can be vulnerable with so that they can open up when they have issues and these issues can be promptly and correctly addressed. This cannot be overemphasized. Thank you so much, Dr. Hope, for speaking to us today. We've learned so much. We are grateful for your impact. And we hope and pray that the good work that you've started in the streets of Abuja and Kogi spreads to the rest of the world and continues to grow. Amen.
Amen. Thank you very much, Dr. Chidima.
All right. So we're going to be bringing this